I hope you're having a wonderful summer, and I'm really excited to tell you some of the wonderful things that are going on at Inspira. I am so pleased that many of our physicians have been honored as top physicians for women by South Jersey Magazine, and we're so grateful that these physicians have really excelled in the commitment and their care of women. Additionally, we are very excited to announce the achievement of the Lifeline Silver Plus Award, which is given by the American Heart Association to our EMS team. This really recognizes the great work that's been done to advance care for what we call as STEMI. The EMS team is the first one on the scene, and it's very important to be able to identify this condition right away, and we're so grateful that the team has stepped up and taken on this extra training and achieved this wonderful award, and we thank the American Heart Association. Which brings me to another achievement, which is our Vineland facility has also now achieved the ability to provide what we call PCI, which everybody else knows as an elective cardiac cath. And we're so very happy that that procedure has begun at Vineland and that we've done our first cases in June, and so grateful to the amazing team down there that has done so much to get ready for the survey. So thank you to the physicians, to the team for all the upskilling that's been done and for the extra equipment that we've purchased in order to make sure that we can provide these services to our community. Speaking of our community, we completed our community health needs assessment. This is required by the federal government. Every 3 years we must complete an assessment, and it's hundreds and hundreds of interviews of stakeholders to really identify not only what our needs are as a health system, but more importantly what the needs are in the community in the 3 counties, primary counties that we serve, Cumberland, Salem, and Gloucester. And I first want to thank everybody who participated in this survey, gave us your feedback. We take publicly reported data, including all of the stakeholder feedback, and we get results. And here are the results as they appear on the screen. It's not surprising to anyone that COVID showed up as one of the top areas of concern, but right behind it was our mental health and behavioral health services. We also saw a real increase in the demand for children's health services. People were looking for specific children's behavioral health as well as just general access for kids. Quickly after that, however, was access to just regular healthcare services. And it really, honestly, I've been doing this for almost 30 years. It was so sad to see that because we've done so much to expand services, especially in New Jersey, for access to health insurance, and it still tells us that we have more work that we need to do. And last but not least is the need to continue access to make sure that people have appropriate food, fresh food especially, as well as just really understanding how to manage our diets. We know that diabetes continues to show up all too often in many people due to obesity, and we just have to keep working on this together. We will continue our commitment, and we take this very seriously and look forward to working with stakeholders in addressing those issues. Lastly, I just want to tell you about this wonderful patient story that we have today. Francis, better known as Fritz Reynolds, who's 63 years old, lives in Mantua. He's a federal employee and also is just so dedicated to the United Methodist Church in Mantua, where he is the community ministries coordinator. And Fritz has really spent probably the majority of his 63 years giving back, caring for others, either through his church or his family. Fritz is the father of triplets, 20 years old now, and Fritz has been one of those people who's been fortunate to never really have a lot of health issues. Recently, he found himself in severe abdominal pain, and he describes it as the worst pain he's ever felt in his life. And it brought him to our emergency room in Mullica Hill. And fortunately for him, Dr. Christopher Bashian was on. Dr. Bashian is both a bariatric surgeon as well as a general surgeon, specially trained in bariatrics. We realized that Fritz indeed needed to have surgery, emergency surgery, to have his gallbladder removed. So he got prepped for surgery and had a very successful surgery with Dr. Bashian. But what Fritz most recognized was the tremendous caring of our team. He was just so grateful. It was another reminder. He sees it all of the time in the work he does at United Methodist, but it reminds him that inside and outside of our walls and in the community, good is being done. And I think that's helpful for all of us to remember during these difficult times. We want to thank you again for your tremendous partnership with Inspira. We're so proud to be continuing to achieve these recognitions and awards and continue to expand our services. All of this we do for Fritz and for each of you to make sure that when you need us, we're there. Until we meet again, be well and stay safe.